using the strategic plan for comprehensive systems building. My name is Deborah Anderson, and I'm with the PDG B-5 TA Center, and I'll be your host for today's webinar. I'm joined today by Judy Wilgren with ACF, Kathy Gillespie and Mandy Reeve with the PDG B-5 TA Center. And we're thrilled to have 3 states, Vermont, Kansas, and North Carolina, and 1 territory, Guam, presenting on the call today. During the webinar, just to kind of set the stage, when we use the term state and grantee, I want to stress that we're referring to both states and territories. During the presentation, please submit any questions in the chat box throughout the session. We'll fit in as many as we can during each presentation. So if you want to just go ahead, we'll monitor the chat box and feel free to ask some questions. And then we hope that we will also have some time at the end for additional questions and discussions at the end. As I said, we have a full agenda, much to share. And at the same time, we welcome your questions, comments, and feedback throughout. So let's get started. I'm going to briefly go over the agenda. The objective for the webinar is to provide resources and examples from states on how to successfully communicate and engage state and community level partners and families in order to support a comprehensive early childhood care and education strategic plan. We're going to use the term ECCE throughout in referencing the comprehensive early childhood care and education system. So I'll do that to save words. First, we'll start out with Judy Wilgren, who will review the intent of the PDG initiative as originally intended by ACF, and that it is to create a plan as the foundation for a comprehensive ECCE systems building strategies. Then we're going to review components that make a plan comprehensive that were shared originally by ACF as you were developing your strategic plan. Kathy Gillespie and I will then share some strategies on using the plan to advance the ECCE system through strategic communications, family community engagement, building strategic partnerships, and then periodically updating your plan to ensure that it's a dynamic and fluid document and that it meets the ever-changing needs of families and children in your state. Throughout our presentation, we're going to hear from state leaders on strategies that they have successfully used in order to leverage their strategic plans. And then Mandy Reeve is going to talk about the importance of the strategic plan alignment with your program performance evaluation plan to ensure that your plan is achieving your desired outcomes and how your PPPE is instrumental in informing updates to your strategic plan. And then I said, as we have time, we'll close with some discussions and questions. All right. So at this point, it is my pleasure to introduce Judy Wilgren. As I said, she's a federal project officer for preschool development grant birth through 5 with ACF.
Good morning, good afternoon, wherever you may be. My name is Judy Wilgren, and I serve as a federal project officer for 9 of the renewal grantees across the country. And I'm happy and excited to see that some of my grantees are presenting today the wonderful work that they are doing at this point in time. Deborah asked me to just provide just a very quick overview of the intent and purpose of your strategic plan. Some of this may be redundant for some of you who have been here since the very beginning and totally, you know, eat, breathe, walk strategic plan in your daily lives and things like that. But I think the major point I wanted to put across, which I think you've probably heard before, is that we want to make sure that as renewal grantees come to the close of their grant period, we want to make sure that you see and view the strategic plan as a living document. It's not an elf on the shelf to be there from now on to, you know, to kind of guilt you into picking it up. It's not to be placed on the shelf of shame is what we used to call it. We used to do strategic plans, and then nobody picked it up again after the grant period. But we want it to continue to be a living document beyond the grant period, as well as the program performance evaluation plan, so that you have that continuous process of continuous quality improvement. So the intent and purpose of the plan is to be the roadmap to improve and maximize the services and programs that are within your state. You're building upon your needs assessment. You've developed your strategic plan. You're constantly reviewing. You want to maximize the availability of those programs and those services. You want to improve the quality of care that is provided through the local programs. You want to streamline your administrative structures. Many of you have enhanced your state advisory councils and created family and parent advisory councils to augment those. And you want to improve your funding efficiencies through blending and braiding of funds where the opportunity exists. As many of you know, or may be aware of, that one of the requirements in the preschool development grant is that you have to update your original needs assessment at least once during these 3 years of implementation. Going into your 3rd year of the grant, many of you went ahead and updated your needs assessment last year. Much of that was prompted by COVID, and you discovered or realized there were areas that you were not addressing in your needs assessment that maybe you needed to look at and include and update in your strategic plan. So as you go forward, continue to keep that process, that cycle in place of updating your needs assessment based on what is happening within the environment, and updating your strategic plan as well. And then, as you know, the strategic plan is very much reliant on your program performance evaluation plan. Many of you designed your program performance evaluation plan to be in alignment with the implementation of your grant, but many of you also are in the process of translating that program performance evaluation plan to be part of your continuous quality improvement system from here on out. Having that said, I hope that many of you have already conducted your needs assessment, updated your needs assessment, and subsequently are updating your strategic plan. And as always, the federal project officers also are here, as well as your TA specialists, to help you in understanding the requirements and what is needed. So I am going to go ahead and turn it back over to Deborah.
Thank you so much, Judy. Always appreciate those thoughtful words as we go into thinking about, again, keeping how to use the strategic plan in order to advance our early childhood system. So with that, we'd like to start out with a couple of polls. The first poll helps us better understand where you see your plan as situated within your state. And it's okay. We want your honest answers because we're really interested in thinking about how to best support states in creating that long-lived, sustainable plan that's very comprehensive. And so we have a poll that's going to ask you about if your plan was only created at this point in time to specifically support your grant, and it will end. If there's multiple early childhood plans in your state and they're implemented separately by programs and agencies, so everybody has their own early childhood plan. If you have a comprehensive plan that's aligned with, that's separate from the strategic plan that was submitted for PDG. So in other words, perhaps your state created a different, more comprehensive plan that PDG aligned with, or your state has one comprehensive ECCE strategic plan with responsibility for implementation that's shared across programs and services within your system. If you have another configuration of that, please comment in the chat box. So overall, as the responses are still coming in, Not very many people have the plan solely as the plan that was written as the PDG B-5 grant plan, and that's its only purpose. Almost half say that their state has one comprehensive ECCE strategic plan. So that's exciting. I think, again, as Judy was saying, that's one of the intents of what we hope to accomplish, is that states really wrap around and create a shared plan with that. So, all right, let's go to poll question 2. And on this question, we'd like to know a little bit more about where you are in updating your plan. And Stephanie, are you able to pull up poll question 2, and I'll just talk about it while they're looking at it?
So since they're in the same poll, they've already been able to start on both.
All I needed to do was scroll, so thank you.
Mm-hmm.
Thank you. Yeah, so we have pretty good responses on that one as well. Everybody's in some place for updating their plan. It looks like about a third of the people haven't yet started on that update. A little over 40% are actively in the process of updating their plan. And just a few people have already completed the strategic plan update. And I'm going to pop over to the chat box to see some of the responses there. Colorado has a process to review and update the plan annually, so they're on an ongoing process for that. Some folks have multiple plans, back to the first question. So, okay, all right, thank you. Appreciate that information. I'm excited to know that many of you are in the process of updating your plan. I think that this webinar is going to be at a good fit for you of where you are in that process. Do we want to share the results with everybody, or do we want to?
I already did, but I can
thank you.
share them again. Yeah.
Thank you. Sorry, when I'm sharing screen here, it's hard for me to.
Hard for you to see it. It's all good.
Yeah. Okay. All right. Very good. Let's move on then, and let's talk about those components of a comprehensive ECCE plan. As you were in the development of writing your plan, there was some guidance that was provided, and I thought that it was worthy of going back and reviewing that guidance today, just to kind of ground ourselves in thinking about how do we develop that comprehensive systems plan. And as we've talked about, said it multiple times, the focus of the PDG B-5 funding was to create that comprehensive ECCE plan that changes the system to maximize options for high quality ECCE availability across the system within your states. A comprehensive plan will identify quality improvements, and most states have identified goals, strategies, and measurements to increase availability and quality. So we've seen that in your plans. Some states have focused on one or two sectors for increasing access and or quality. And if you feel that your plan is too narrow, and we'll talk about this more later, this is a good opportunity to think about potential updates to your plan based on thinking about what are some good components that we want to be sure we have to ensure your plan is comprehensive. A comprehensive plan also focuses on the strategies to streamline administrative infrastructure and improve funding efficiencies. And I know those are some conversations that we've been having in multiple formats of what does that really mean, and what are some strategies that could be employed to do that. Comprehensive plan focuses on reducing redundancies, leverages or shifts funding to maximize availability and quality. And some states have created new governance structures and implemented new financing mechanisms to create efficiency. So we're already seeing some great outcomes that have occurred as a result of people getting together and creating these more comprehensive plans. Comprehensive systems plan must strategically engage partners. This is about collaboration and engagement to accomplish systems level changes. And so next, we're going to discuss some strategies to advance a comprehensive early ECCE plan, and we'll hear from some states about how they have done that. And then finally, creating a comprehensive ECCE strategic plan. To reiterate what Judy was saying, the plan that was created using PDG B-5 funds is not intended to only be a PDG B-5 strategic plan. Want to focus your plan on comprehensive ECE systems building activities and design the plan to live into the future and beyond funding for PDG. So all the things that we're going to continue to talk about today will really stress and reinforce that and give you some concrete examples and recommendations of how to do that. So next, we're going to hear from Kathy Gillespie, who's going to talk about how to strategically communicate about the plan. Kathy is the Director of Technical Assistance at ANLAR and serves as a consultant to the PDG B-5 National TA Center. So Kathy, take it away.
Thank you, Deborah. Can you guys hear me okay?
I can hear you.
Excellent, thank you. Just
Yes.
checking since we had some issues ahead of time. Thank you for having me, Deborah. As she was mentioning earlier, one of the first strategies that we want to help you think about today for stakeholder engagement is this idea of a communications approach. We're specifically using that word instead of a plan because you're already talking about a strategic plan, but want you to start thinking about and using a communications approach. Now that your plan is complete, we want you to really think about how you put communications in place to let your key stakeholders know what's going on. So within the PDG B-5 Center, we've been working on a document for you called a Guide for Communicating the Strategic Plan for a Comprehensive Statewide Early Childhood Care and Education System. It's going to be available early next month, but the things that I'm going to share with you on this slide give you a little taste of what's contained in that guide. So a critical first step in communicating about your strategic plan is to identify why you are communicating. This will help you set the framework for your messaging, and it may be different for different audiences. You might ask yourself, for example, is the goal of communication awareness of need, or is it to receive feedback on a plan to inform future revisions, or is it to build support for funding or new policies? All of these will have a different why behind the messaging. Once you've identified your purposes, it then becomes easier to think about your intended audiences and identify them more specifically. If you're building awareness, for example, your audience is probably the general public. Feedback and input on the plan will be targeted more to providers or to families who are impacted by the activities on the plan. A comprehensive plan that is focused on funding will require communication to state leaders, legislators, and other decision makers, for example. Keeping your purposes and your audiences in mind, this is when it gets to the point of time to make sure we know what your message will be. Sometimes we make the mistake of skipping straight to the message without thinking about the audiences and the purposes first. But as you're doing this, what we'll ask you to do or to think about in this guide is to identify what information needs to be included for each audience and for each purpose, and then thinking about how you can use data and anecdotal stories, particularly from the people who are in your system, to lend some credibility to your communication. Keeping your focus on the future and sharing next steps will be a critical piece, because merely communicating progress to an audience is not going to necessarily hold their attention or help you with your future efforts. So then the next step is determining how you'll communicate and how often you'll be sharing messages. Again, this is driven by purpose and audience, and it may differ depending on the groups that you're communicating with. This how includes who's going to lead the communication, the media that'll be used for communication, and how often messages will be shared. One of the things that we highlight within the guide is the need to communicate frequently and not just one-shot deals here and there about the strategic plan. But thinking about trusted messengers such as physicians, teachers, and parents are key for those public audiences. And when you're communicating with public leaders, it's critical that you and your state team and engaged partners are prepared to confidently explain the goals and the status of the plan. When decision makers are aware of the priorities in the plan, what we're seeing is that it'll increase the likelihood that your hard work will inform how you and your state will fund new initiatives. So this is why it's really important. So finally, ongoing communication is critical to sustain your plan and the activities within it, particularly to make sure that your plan remains comprehensive and relevant to the current needs in your state. Periodic communication can share progress over time and illuminate new needs or updated needs. And when you update your plan, communicate about why you made the changes and what you plan to do next so that you can build credibility and support for the sustainability of the plan. So as I mentioned, the guide for communicating the strategic plan for a comprehensive statewide ECCE system is going to be available in early March, and it will have some additional tools and resources to help you think through each of these steps about communicating your plan. I'm going to turn it back to Deborah to take us on to the next part of our presentation.
Thank you so much, Kathy. The brief that Kathy shared, that Kathy developed is definitely worth a read. It's got so many great ideas on there around communication. So thanks for that presentation. As we looked at how different states were communicating about their plan, we found a couple of examples. And so I just wanted to highlight California has used some momentum to create a master plan. So they received the PDG grant and the state developed a master plan. This is a link, and I'll put it in the chat, that links to their their interactive website around their master plan, which is very engaging and has parent stories. Colorado created a mid-project progress update. So they have a 2-pager infographic that is easy to read and really highlights the great things that they've done. So those are 2 examples of communications. But we are also pleased today to have Morgan Crossman. Morgan is the Executive Director of Vermont's Early Childhood State Advisory Council, Building Bright Futures. And under Vermont's initial planning grant, they created a comprehensive strategic plan that has sustained, despite the fact that Vermont was not awarded a renewal grant in the last round of grants. So Morgan, I'm going to turn it over to you. I'll stop sharing screen. And can you share with us about how you communicate about your strategic plan to build or enhance your comprehensive ECE system in Vermont?
Yes. Can you hear me okay?
Yes.
All right.
Okay.
Thank you so much, Deborah. As she mentioned, I'm Morgan Crossman. I'm the Executive Director of Building Bright Futures, and BBF, or Building Bright Futures, is charged in Vermont's state statute as Vermont's Early Childhood State Advisory Council. And so that is the primary mechanism used to advise the governor and the legislature on the well-being of children prenatal to age 8 and their families. And in Vermont, BBF is charged with maintaining the vision and strategic plan for the early childhood system. And in Vermont, we call that the Vermont Early Childhood Action Plan, or the VCAP, and that was revised under year 1 of the preschool development grant. And to monitor that strategic plan, we maintain a network of over 450 partners, both public and private, that are coming together monthly through strategic plan committees, through regional councils, and the State Advisory Council to monitor progress. And as part of our work, we're committing to using the most up-to-date, high-quality data to inform decision-making and serve a critical role in Vermont in operating as a broker of that data and information to guide policy decisions. So what I want to show you today is a couple of the ways that we communicate about the strategic plan and how we use it alongside other data to monitor Vermont's early childhood system. So the first tool that I want to show you, it should be on your screen now, is Vermont's Early Childhood Data and Policy Center. And this is vermontkidsdata.org. So you're more than welcome to go. This is a live site. It is a work in progress and something that we are consistently building upon. But this is one way that we're communicating and building shared accountability for and through our strategic plan. So the screen that you see right now is the front page of the VCAP, or the strategic plan dashboard. And in Vermont, we created this because our PDG needs assessment identified it as a critical need to centralize early childhood data and policy work. So Vermont's vision for the early childhood system, and that's in green on your screen right up here, is for the early childhood system to be an integrated continuum of comprehensive, high quality services that's equitable and accessible and will improve outcomes for each and every child in the prenatal period through age 8. And we've identified 4 goals that you're seeing listed in the bullets here. And each of those goals is aligned with a layer or a level of an ecological framework. So starting with all children have a healthy start, families and communities play a leading role in children's well-being. All children and families have access to high quality opportunities that meet their needs, and that the early childhood system will be integrated, well-resourced, and data informed. And so I want to make sure that you know that this dashboard that I'm about to walk you through is a work in progress. We are continually identifying indicators, but what you can see here is that for the first time, we have indicators associated with each of the goals. So as you click on, for example, goal 3, all children have access to high quality opportunities, and you navigate to an outcome, for example, in the area of development and education, you can scroll down and see a range of indicators across different sectors to tell us what the status of kids and families are. And so the one I want to call your attention to is, for example, universal pre-kindergarten education. So in Vermont, we afford UPK to all 3 and 4-year-olds and 5-year-olds not yet eligible for kindergarten to 10 hours a week for 35 weeks out of the academic year. And so what you're able to see in a very quick snapshot is a description of universal pre-K, where to go for more information at the Vermont Agency of Education, but also our trend in enrollment over time. And, I think what's really interesting is how we look at these trends and map to what's happening across the country federally, what's happening in the COVID-19 pandemic, and what we want to expect or what we hope to see in the future for some of these indicators. Another example outside of early care and education, but for example, mental health, might be looking at indicators of the percent of children with a mental, emotional, behavioral health or developmental condition. So this data is coming from the National Survey of Children's Health. And here what we see is, as of 2020 data, 1 in 5 children between the ages of 6 and 8 have one of these conditions. What's not yet captured in this visual is that we in the state of Vermont have actually seen across every single one of these age ranges at the bottom an increase in the percent of kids having those conditions over time. This dashboard also lets you take a look at, for example, the number of children who are receiving crisis services over time, or the number of children served by our designated mental health agencies. So again, in thinking about the COVID-19 pandemic and what to be watching for, and how we're moving towards all children having a healthy start in the state of Vermont, this dashboard is really a powerful tool for us to see all of that in one spot. I apologize for the scrolling. I want to show you one last piece of this, which is a really robust repository of publications that we've put together, including the last 5 years of documentation and publications on Vermont's early childhood system across a range of different sectors. You'll see statewide needs assessments, some national publications, and then you can navigate through by topic area to follow that pre-K trend. Again, where are all of the documents related to universal pre-K, and where can you go for more information? So that dashboard, again, is just a prototype for how we are working to centralize data in Vermont's early childhood system and making it publicly accessible, and using evidence and data to inform decision-making alongside our strategic plan. So you'll notice as you navigate this site, there are a range of areas that we are still building out, and we're seeking additional funds to support that effort. But we're really trying to move in the state of Vermont toward an integrated early childhood data system. And as we think about how we communicate this information out to our networks, again, we're convening over 450 early childhood stakeholders, including, public partners as well as private partners, advocacy groups, private philanthropic partners, to communicate not just about the strategic plan, but the data they need to use to inform their decision-making, their own strategy for how to reach our ultimate goals. The second tool that I just want to mention that I believe I can put in the chat bar is another way that we articulate data alongside our strategic plan. So we are annually mandated to produce a report called the State of Vermont's Children. So that includes a compilation of early childhood data. It includes recommendations endorsed by the State Advisory Council, and those recommendations are developed annually on behalf of our entire network to help us move towards the vision and goals we've articulated. So I appreciate having the time today. I'm happy to follow up with folks if anyone's interested in hearing more about Vermont's Early Childhood Data and Policy Center. Thank you.
Great, Morgan, we have a question from Megan. How is this effort in Vermont funded since you did not receive a PDG renewal grant? And of course, she also said amazing stuff.
Thank you, Megan. It's a really great question. So as I mentioned, Building Bright Futures is Vermont's state advisory council. And in that way, we not only are named in statute, but we receive an allocation from the state on an annual basis. It doesn't cover even 50% of the costs that it takes to run Building Bright Futures State Advisory Council Network, including those 12 regional councils. So we have the folks on the ground who are consistently identifying the needs, challenges of families and communities, elevating those up to decision makers, those 7 strategic plan committees and the state advisory council. So we are consistently writing additional grants, working with private philanthropic funders to help fill some of that gap. But I think that we've been really proud of the work that happened under the preschool development grant in year 1, and we've consistently integrated it into all of our work across what we're doing in the early childhood system, and really trying to continue and move that forward. So really excited about future opportunities as well.
Thank you so much, Morgan. Such a great example of how you're really using data to tell your story. So we appreciate that. And next, I'd like to introduce Melissa Roker. And Kansas has provided their update on progress and bright spots through a pictorial graphic. If I'm calling that right, and correct me, Melissa, if that's not the right term. Melissa is the executive director of the Kansas Children's Cabinet and Trust Fund, and she's here today to talk with us about Kansas's approach. So Melissa, tell us about how you communicate progress about your strategic plan to build on or enhance your comprehensive ECCE statewide system.
Well, thank you, Deborah. It's a pleasure to be here with everyone. Kansas really built a communication strategy into the process of doing our original planning grant work, the initial comprehensive needs assessment, and the creation of the strategic plan were really interactive experiences that ultimately involved over 6,000 Kansas voices as we shaped the understanding of where we were and where we across the state at the community level hope to go with our early childhood system. So we really built on that commitment to two-way communication as we have embarked on our renewal grant activities and the work of keeping people informed. So we have a variety of communication tools. The one that's featured here involves a graphic recorder, an artist basically who attends our meetings, which was a lot more fun when we were meeting live and you could see Sarah's work emerge on the mural on the wall, but she still has managed to help support our work through all the endless hours of virtual convenings that we've held. But it's really a way to bring the work to life because it's her reflections on what she's hearing as we meet with various groups and in various settings. So that's been fun, and we try and keep those embedded on our website, and we inform different forms of communication. We really from the very beginning created a culture of communication that involved a weekly newsletter to stakeholders that, the following was built over the course of that planning grant year. And we have continued to curate it very carefully, inviting people to follow us. So we send a weekly email with progress update and any news and information about special projects and opportunities. We have a bi-weekly webinar that we do live every other Wednesday at noon for an hour. And we have used that both to share information out and to take feedback that we need. I think the most notable was with the onset of the pandemic in March of 2020, the week that schools shut down. And keep in mind, Kansas was the first state in the country to make the decision to keep schools closed for the duration of that school year. We used our webinar as a listening session, and we went from the typical, we have generally 50 to 75 people on average attend the webinar live. That day we had over 500 attendees. And so we listened, we took feedback, and it got translated into a mini grant process that we used some PDG funding to help solve the immediate needs in that initial stage of the crisis before the CARES Act existed. We got supply and quality grants out the door to help people cope. We use our children's cabinet meetings, which are bi-monthly, as a platform to feature the work of preschool development grant. The children's cabinet serves as our state lead, and our 3 partner agencies, our Department for Children and Families, Department for Health and Environment, and Department for Education, are all both partners in our PDG work, and they have a seat on the children's cabinet. So we really have anchored the work in our strategic plan. And that's really been key, is throughout all of the work across the 4 of our state agencies, the various components of our governance structure, what we emphasize always is alignment with our strategic plan. So we will create reports that will pull the specific goals, strategies, and tactics. So we have everything identified numerically. We can tag most of the projects that we undertake, or proposals that we submit, or progress reports. We're always anchoring in the specific elements of our strategic plan that activity speaks to. And we also have been cross-referencing with our CCDF state plan, just to be sure that everybody is aligned. And so wherever there are other plans that exist, we try and make sure that we are aligned. That's been a major focus. And then, just the obvious social media, and creating the hub on our children's cabinet website, which I've linked in the chat bar for you all. We created a specific area of the children's cabinet website for All In for Kansas Kids, and you can find all of our reports, and the graphic reportings get spotlighted, and we feature bright spots. We will feature projects and progress reports that create happiness among our team, that we met a particular milestone or what have you. We are in process. We've focused on a strategic plan progress report that we will now turn attention to converting into an update to refresh the strategic plan. But we intend for it to be a living document for Kansas. And I'm really proud of the way multiple state agencies are making use of the All In for Kansas Kids strategic plan.
Thank you so much, Melissa. I had the opportunity to begin to receive Kansas's communications. I was a neighbor in Oklahoma at the beginning when we received our renewal grants, and they have just done an amazing job of casting a wide net and sharing their progress and updates and the work that they're doing. So great job on communicating. I've really enjoyed your work. All right, next I'm going to move into talking a little bit about the importance of engaging families and communities in an ongoing way, so that it can continue to inform the progress on your plan. When you are actively and deeply engaged with families and communities, you're establishing that process for continuous feedback. Sometimes we can have really great ideas that end up having unintended consequences when we begin to implement them. And we don't know that until we spend some time actively engaging with families. It helps develop models for family leadership. So as you begin to engage with families, and we're going to hear from North Carolina about the work that they've done to really create family leadership, so that it's not only being informed through parent cafes or going to parent advisory councils, but actively building a family leadership model in the state is a great way to ensure that your plans are meeting the needs of families. Actively engaging can ensure that you gather diverse perspectives, which is a huge key to ensuring that you're creating equitable outcomes in your state. Want to hear from different people in different places across the state, in different family situations. One size does not fit all. That's a phrase we often use, but as we've developed our plans, as you ensure that you're getting diverse perspectives from lots of people with lived experiences, it will help ensure again that that plan is relevant and being culturally responsive in your communities. It also helps capture anecdotal data, and anecdotal data is really powerful when you're trying to get funding, when you're trying to engage business leaders or other investors into your work in your state. It's great at the legislature. You know, you've got to bring that anecdotal data along with your data that you're collecting that can really tug at the heartstrings. And when you're actively involving families, you readily have families that are available that can help share their stories and are willing to let you help share their stories to help improve the system. And I think importantly, it creates a culture of shared goals. So this should not be a state plan, a state level plan. It needs to be a plan for the entire state. So ongoing engagement with families and communities ensures that they are right there with you with your goals, and that they agree and they're represented by the plan, and they see themselves in the plan, and they see that this is a common direction that everybody's, a common step that everybody's taking. So with that, I would like to introduce Christy Snuggs, who is with, I've got to get her official title correct. She's the Deputy Director at the North Carolina Division of Child Development and Early Education. I know her best as Christy. And Christy's going to share how North Carolina is engaging community partners in data-driven strategic planning and building parent voice within their state. So Christy, take it away.
Thank you, Deborah, and thank you for having us. And I'm glad to be with everyone this afternoon or morning or wherever it may be for you. Real quickly, I want to go backwards just a second to talk about how we created our original strategic plan. And then I'm going to turn it over to a great colleague, Kate Irish, to talk more specifically about family engagement components of our strategic planning. So North Carolina has a comprehensive strategic plan for early childhood. It actually, we began working and drafting it back in August of 2018, prior to receiving our PDG renewal grant. Actually, we were given an executive order by our governor to create, the Department of Health and Human Services was given this executive order to create a plan. And we created what we called the North Carolina Early Childhood Action Plan. This really outlined a cohesive vision. It set benchmarks for impact by the year of 2025, and it established this shared stakeholder accountability to achieve statewide goals for young children from birth through age 8. The plan really centered around 3 themes: that North Carolina's young children should be healthy, they should grow up in safe and nurturing environments, and they should have they should be well supported to be ready for learning and to be ready to succeed. And so this plan provided a framework for really galvanizing coordinated action across public and private stakeholders throughout North Carolina by making measurable changes in early childhood outcomes. And as part of this planning process, we engaged over 350 stakeholders, including families, as well as professionals. And we received feedback from over 1,500 providers and family members and stakeholders in early childhood. So when we received our renewal grant and had to go through the needs assessment process and the strategic planning process, we continued this idea of collaboration as a key component for our efforts, engaging many, many partners who actively participated in developing a more focused strategic plan that was built from the Early Childhood Action Plan. So while the ECAP, as we call the Early Childhood Action Plan, provided this strong plan for the entire early childhood system, we, our division and its collaborative partners, actually utilized the strategic planning process of the Preschool Development Grant to really drill down and be into more specific strategies that we could focus on in the next couple of years. So again, the stakeholder engagement was a key component. The planning process emphasized how our mixed delivery system and engagement of community leaders, as well as families to accomplish these targets, were so important for North Carolina. So that's where we started. Now we're ready to update our strategic plan. We're updating our needs assessment as we speak. And as a way to update our strategic plan, we began to figure out, how do we create these ongoing natural feedback loops that we're hearing from our communities, and the state and the local communities are engaging and moving things forward in the same direction. So we are currently partnering with the Hunt Institute to execute a training and technical assistance strategy to support 30 local county human services teams in developing data-informed early childhood strategic plans. So we have the state level plan, but now we're working with our local communities to create data-informed early childhood strategic plans at the local level. Our goal is to do the things that we've been talking about on this webinar, is to increase their capacity to collect, manage, and use quality data to support data-informed decision-making about programs, about policies, about practices, about funding. And we know that this work is going to build on the early childhood strategic plan that we have at the state level, but it's going to provide those local leaders the support they need to align state and local early childhood improvement efforts. To date, we have 7 teams that have been selected. They're supporting, their 8 counties are represented, and it's really over 3 major regions of the state. This is our pilot cohort. And then our next steps is that we are preparing to recruit and train and to provide technical assistance to an additional 23 teams through this year of 2022. And, you know, one of the things that was interesting to us, eventually we want to make this across all 100 counties. We don't think we'll do that during the PDG funding, but we are using this as an ongoing document, something that we're going to continue to do and something we want to sustain. And so we plan to expand this to all 100 counties in North Carolina. But a couple of points that I'll just make is that during the applications for these local data planning teams, they acknowledge that they have many councils, many committees in their communities that are charged with developing various plans and proposals to support county level improvements. However, they also acknowledge that many of these teams consist of the same individuals, and they noted that there were gaps of where they really can improve with representation, but also gaps of where they can make a really strong impact. So we hope that through this initiative, these teams will learn how to leverage data to strengthen and coordinate their local early childhood strategic plans, and also build those cross-sector relationships, which are key in making sure that progress happens, not only with the leaders, but also with the families in these communities. We also believe that they will, through our ongoing technical assistance and coaching, be able to develop, evaluate, and disseminate their data-informed local strategic plans and really begin to move North Carolina forward at the state and at the local level. Additionally, we think this initiative will help counties take a step back and really explore other local, state, and early childhood improvement efforts underway in their communities and determine how to align and coordinate their data and resources to address needs and take actions that are outlined in their local strategic planning efforts, but also at the state level. So we are extremely excited about this work. We also think it's going to help with sustainability of the work that started under PDG, because ultimately our goal is to scale this initiative to expand to all of our 100 counties and to create coordinated and united efforts to make sustainable and impactful early childhood system improvements to benefit both providers, the children, and the families that they serve, both at the state and local level. So that's one strategy that we're using, but I am going to now turn it over to Kate to talk more about how we're engaging the families in the process. Kate?
Thanks, Christy. Can you all hear me okay?
Yes.
Okay, great. So glad to be here. I'm part of North Carolina's PDG team, and I'm supporting family engagement and community collaboration. And as Christy said, you know, our North Carolina strategic plan has really focused on family leadership. One of the goals of our strategic plan that was developed in 2019 is to increase families who are engaged in leadership activities and are empowered to advocate for their children. So we're really seeing this as an important focus and a really critical strategy for informing the strategic planning and the strategic direction for our system moving forward. I was thinking about what Judy was saying at the beginning about strategic planning should be a living, breathing, evolving, you know, document and process, and engaging families and embedding them in the process is a really important way of doing that. I think in the past, we've shared on some of these webinars, some of the North Carolina's work around our family engagement and leadership framework. But that was a really important guiding document that was developed back in 2019 that outlines some of our key guiding principles and best practices for family engagement and leadership. So that was sort of a really important milestone for us, but also it was the part of what was so important about that was the process as well, because that's where these feedback loops were really being developed. So we're having, with PDG support, we were having local intensive family engagement and leadership planning through our Smart Start partnership network. We created a state level family engagement and leadership coalition. So that was a large group of folks that were both from local communities and the state level, included a lot of really like rock star parent leaders that have been on webinars with us before here too. So that was a really great group that was formed. And then at the state level, having an accelerator team is what we call it, which is a smaller group that was really focused at the state level, but also consisted of family leaders as well as state partners. So we sort of developed those different groups and bodies and developed this loop of feedback and informing and developing that framework. So I kind of just described that just to say that that was what really has been kicking off and guiding all of this work so far. And now we're really looking at how to embed the framework and these feedback loops within our system in a sustainable way, which is really what Deborah was talking about in the beginning of how do we do this in an ongoing way and get continuous feedback. And so that's really where we are now, is looking at different ways of doing that, putting our framework for family engagement into action. And so we have a lot of things going on, but we're focused on different levels, as you all know. It's so important to look at the systems and policy level, but also the professional and program level, and also the development of family leaders, that level. So we have projects going to further each of those areas. So in terms of looking at our early childhood system and how we're going to embed family engagement best practices in a meaningful way, we're in the process of conducting a landscape analysis. So we're really going to use our framework and use that as a guide to determine sort of how our system is doing right now. Some of it we know, but some we want to learn more about, sort of where do our system partners, where they're doing really great work that we can highlight, where are there gaps or needs for further support. So really wanting to see that framework become action, but first needing to know exactly where things stand right now. So we're really looking at that, and we'll be talking, interviewing and surveying partners to understand how family engagement and leadership is or isn't being embedded right now, and in looking at things like leadership and infrastructure, funding and policy. So that's part of sort of the assessment of our system, how things stand right now. And then meanwhile, we are also embarking on a train the trainer development. So really looking at how we can support agencies and program staff in their work to welcome families and engage families as leaders. So we've really learned already that there's just a lot that agency staff and professionals need to know more about and need to have skills and process to really welcome families in a meaningful way and support them in a leadership role. So we're working with the Early Childhood Investment Corporation in Michigan to develop a Train the Trainer series. It's really going to focus on that. It's the first meaningful way we're going to be able. And then in terms of the family level, we are focused on continuing to sort of build that pipeline of family leaders and support them. And so we're planning a virtual family leadership conference in the spring, where we'll have multiple tracks for families to participate in and learn about advocacy and empowerment and support in different levels, looking at how they can be advocates for their own children. They can advocate and support community services and programs, as well as the state level, and how they can really impact policy change. So those are sort of the elements that we're really actively working on right now, again, with our focus on action and sustainability. So our goal is by the end of this PDG grant to have action steps and an action plan focused on family engagement and leadership that will inform the state in doing the good work of family engagement leadership, but also really inform the strategic planning, strategic direction for North Carolina, and have these feedback loops really be a continuous source of input and feedback for planning over time.
Thank you so much, Kate, and thank you, Christy. So appreciate your thoughtfulness and describing for all of us how thoughtful you have to be to have those continuous feedback loops. It sounds good. Putting it into practice really takes some planning and a lot of support. So thanks so much for that. Just a second, I'm gonna go back to our slide and talk about our next strategy that is about building strategic partnerships. And Christy really talked about this a lot in the work that they're doing in North Carolina, but there's some important reasons about and some benefits with how your strategic plan can really provide a framework to help foster collaboration across programs, across your system. True collaboration engages program leadership to share ideas, co-create, and co-decide. And many of us have sat around the table with our partners, and we all share a lot of information. Really moving into collaboration takes, again, sharing ideas, co-creating and co-deciding how you're going to move forward. And that also is very, very hard work. The strategic plan then can become a document that reflects that common vision, goals, strategies, and measures. And each partner should be able to see their program goals reflected in the plan. So if you're having trouble engaging a partner, are they seeing themselves in the strategic plan? And if not, then how do you bring that partner in, and how do you work on that, perhaps in a revision? You can use your cross-agency meetings to check in. So one strategy to ensure that everybody's all on board is to use your cross-agency meetings to check in. Make sure that that plan continues to represent the comprehensive ECCE system. And make sure that if you need to update to ensure that partners are reflected, that's part of the conversations that you can have in those settings as well. Ideally, shared responsibility for implementation will occur across the system. Do partners have responsibilities identified within the plan? And are you checking in to make sure that the things that they are contributing to the plan, is there a space where everybody talks about their role, brings their data to the table and ensures that their progress is being reflected and their input is being included. Not all partners are going to be responsible for all aspects of a comprehensive plan. And so engaging some partners might mean just sharing communications, as we talked about earlier, to make sure that people are aware of the plan in progress, understand their role, and partners need to be able to understand their role in implementation of the plan. They need to be part of reviewing the progress and helping with problem solving with implementation challenges and actively participating in plan updates. So as you're engaging families and communities and you're having conversations at the state level, keep that a broad-based conversation to help people have that shared responsibility for how they're going to reach better outcomes. Using the strategic plan to build and maintain strategic partnerships takes time, takes personnel, and it takes resources. So beyond the PDG grant, right now you may have staff that are dedicated to that. So beyond the PDG grant, as you're thinking about into sustainability, think about is there a central entity that would be identified to continue to champion the plan? The plan needs a home after the PDG B-5 grant. And so be thinking about that also as part of your sustainability. States are doing a great job of updating partners on implementation of the plan. Think about the focus of your discussion about how to do more than checking off activities. So again, really ensuring that you're having conversations with questions such as, how well is our state doing in making progress? What else do we need to do? Who else do we need to engage in order to accomplish our intended outcomes? So again, an iterative process, thinking about what you hope to accomplish. So at this point, I would next like to introduce Elaine Eclavia. And Elaine, I may not have totally pronounced your last name correctly, so I apologize for that. Guam discovered that they needed a revised governance structure in order to support their comprehensive ECCE system goals. And so Elaine is an early childhood consultant with the University of Guam, and she's going to share the monumental restructuring that occurred in Guam to better support their system. So Elaine, tell us about how your strategic plan was used to influence state governance in your territory.
Thank you. Hafa Adai, and thank you for the opportunity to share. Just like how a baby goes through many developmental stages, Guam within its governance structure has experienced the same and is about 18 years in the making. Beginning in 2004, an executive order established an executive committee on the early childhood care and education. The committee was tasked to develop, implement, and oversee Guam's comprehensive plan for the early care and education of young children. The following year, Guam applied for the ECC state grant and laid the blueprint of how Guam will carry out an island-wide cross-agency early childhood comprehensive system. And in 2008, through an executive order, the Guam Early Learning Council was established and was enacted into public law in 2011. That formalized the importance of coordination and collaboration among agencies and organizations, both public and private, that serve young children birth to age 8 and their families. Our vision or our mission is to support all children birth to age 8 reach his or her full potential through an equitable health and education system that is accessible, comprehensive, integrated, and responsive with a diverse culture and developing collaboration with families and communities. This governance structure includes a member of Governor Lou Leon-Guerrero's cabinet and their designee. The leadership team of the council are the administrators of the early childhood programs that ensure that the partnership in collaboration with the Department of Health and Social Services, they're the responsibility entity for the development, implementation, and monitoring and evaluation of all activities identified in the grant. Guam PDG just completed its initial grant in December 2011 with the completion of the needs assessment and the strategic plan. So Guam is on year 1 of its renewal grant, which provides the mechanism for health and education programs and public and private community stakeholders to define, evaluate current practices, and determine how children will have equitable access to high quality early childhood care and education. The figure that Deborah is going to pull up real quickly is our governance structure, and it depicts the ancient Chamorro hut with the latte stones, which are the foundational pillar. The Guam Early Learning Council, the roof of the hut, serves as the overall advisory for the Guam ECCE system. The latte stones are the key strands and the foundational support for the early childhood programs that include policy and governance, maximizing parent choice, family supports, physical systems, professional development, data system, quality, accessibility, and support. And for the past 2 years, thank you, Deborah. For the past 2 years, the council and I have been working for ensuring and monitoring the services across early childhood programs during this global pandemic. With the American Rescue Plan, the council worked to develop a crosswalk document which provides information about funding allocation to each program and how the funds will be spent. This process allowed the programs to share ideas, to share information and resources, and to maximize their funding and not to duplicate activities. The leadership team worked well and have worked in partnership across systems around early childhood initiatives. That has been transformed to the integration of policy, procedures, and practices in what and how we do things. We, or I, thought we were doing well. But prior to the PDG annual convening session in October 18, we got word that the governor had decided to give $20 million to the CCDF APR funds to the Guam Economic Development Authority to work with child care centers in their application for the usage of the ARP funds. With that announcement, the council and leadership team was concerned, especially since there was no communication with the council. So when the PDG convening started, the first plenary session with Katie Ham and Miriam Aldred, it was like they were really talking to us, or talking to me. Miriam made several points. She talked about the importance of talking to and educating our leaders about investing in science of child development. And as leaders, we can't stay in our comfort zone. And I was reflecting comfort zone, right? And so some of us may not be in the position to make decisions, but I think we as leaders need to speak up about the choice points and always advocating to keep children and families' need in the center of our action. So right after that plenary, right after that session, I sent a letter to the governor's director in communication regarding to meet with the governor to share the council's needs assessment and state plan. Within the next few days, the governor's chief of staff requested to meet. The meeting with the chief of staff included the deputy for the Department of Health and the PDG director. I spoke about the investment, the importance of the early years. I showed pre-COVID data and post-COVID data. And the data really surprising, especially looking at the number of children with social emotional challenges and the impact from the loss of staff during COVID. I spoke about the lack of availability of childcare services and families not accessing other early child programs. He asked, how are we addressing that? And we spoke about the state plan and what are some things that we could do now. We spoke about bringing services to the village level due to the lack of access to transportation and needing to provide alternative childcare service and support, such as village playtime, especially to children and families that cannot afford formal childcare services. We spoke about how families need a one-stop center, a Bureau of Children's Wellness. And for years, families have expressed this need, and we have worked to align the early childhood programs under a bureau. However, our biggest hurdle was other competing priorities that continued to get in the way. So we shared the challenges with our federal partners, Brenda Wilkinson and Richard, and they suggested perhaps an executive order is one way to get it done. Well, within the week, the governor signed an executive order that put a division of children's wellness, bigger than what we thought a bureau would be, within the Department of Health. This bureau would include Child Protective Services, Child Development Block Fund Project, and the PDG just as a starting point. And so we continue to work and shift within our governance structure. We recently did a similar meeting with the acting chief of the new division to provide a similar session as we did with the governor's chief of staff to share the objectives and the activities of the state plan. The strategies we used was to cultivate the relationships, emphasize the science and the data, especially the data from the needs assessment, and always keeping focus on the needs of children and families, which are reflected in our state plan. And keeping our true to the vision for ensuring all Guam's young children have healthy minds, bodies, and spirits as a foundation of lifelong success. And I think for us, it's always going back, never being too comfortable about where we are, but always looking forward, because there are, new folks coming in into our system, into our government, and really making sure that we're not stagnant. And so just hearing those things at the plenary was like, okay, our work is not over. We got to keep it up front and sharing what children and families need. So thank you.
Thank you so much, Elaine, and thank you for really sharing how the messages are continuing to resonate and making a difference. So, and excited for the work that you're doing. Very, very nice. All right. Next, I'm going to just talk a little bit about updating the plan. And I think the primary message that I really want to convey is to, as much as possible, don't look at updating your plan as a one and done. You can update any part of your plan at any point in time that you want to. As you've reflected today, and we've heard from some states that really want to broaden the scope of their strategic plan from maybe what they originally wrote, either due to time constraints or now they've had bigger ahas, as Elaine has talked about. Think about your updates to ensure that you have systems level goals, not just program level types of focus, but think about those things that we talked about with a comprehensive plan. So as part of your update, just review and make sure that you're really addressing your system as part of your plan. Take your updates as an opportunity to engage new strategic partners. If you've had partners that have not been involved, as I talked about building partnerships, your plan is a really, really good opportunity to find some new strategic partners that can help you accomplish those goals. In your plan, and write it down, identify those shared responsibilities, how things are going to be funded. If you need sustainable funding, really take this opportunity to drill down on details to think about how your overall systems plan is going to be implemented and who has responsibility for that, both in their program scope and with funding that they may need to continue. Some of the systems level goals just kind of need people to keep the conversations going as you identify potential policy or even procedure changes. So really think about, what's going to need some specific funding and what's just going to ensure that you have that ongoing collaboration. If you feel that your plan is more restrictive than you'd like it to be, then part of your update can really be to broaden that plan scope and authority. We have some questions that I'm going to pause on and turn this over to Mandy for a moment and let her talk about alignment. And then when we go to questions, I want to start by asking each state, how do they see their state updating and using the strategic plan beyond the PDG B-5 grant initiative? But first, let's hear from Mandy on alignment of the program performance evaluation plan. So Mandy, you want to take it away?
Yeah, great. Thanks, Deborah. So I only have one slide, and I think that's perfectly fine because there's been so many great examples in the last hour of how strategic plans are being continually updated and changed to meet needs. And I'm just here to give your friendly public service announcement that as you're updating your strategic plan, you should be updating your program and performance evaluation right along with it. One of the most common challenges we saw in the first year of PDG when we were reviewing program performance evaluation plans is that the outcomes were not aligned with the state strategic plan. And so as you update your strategic plan, you should be updating the different components of your PPEP that need to be updated as you go. So if you add a new objective to your strategic plan, think about how that impacts your logic model. All good PPEPs rest on a foundation of a solid logic model. If you have a new outcome, think back, think to your inputs, your outputs, what activities are going into your communities to make that outcome achievable. I won't go through each one of these. If you have questions, I would recommend you really watch Kathy Hebler's PPEP webinars. But I think you're getting a great taste for why and how to be continuously updating. And so don't forget to align your evaluation plan with your updated strategic plans.
Thank you, Mandy. All right, so it all comes together. We've talked about communicating, engaging families and communities. We've talked about using your plan as an opportunity to build partnerships. And then the last thing we talked about is really that update of your plan can be very instrumental in putting that all together and thinking about if you have areas that you'd like to focus on again. And so I'm going to call on each state, and I'd like to hear from Vermont first, because they were not a renewal grantee. And so Morgan, can you talk with us a little bit about what Vermont is thinking about the strategic plan? And if you have plans to update that, or if you've done some updates, but just share with us a little bit about your updating plans.
Sure, thank you. So what's interesting is that our original strategic plan for early childhood was created under the Race to the Top Early Learning Challenge grant, and we used the Preschool Development Grant Year One opportunity to do that first update. And so what we saw is that we've really looked at this plan as Vermont's early childhood strategic plan, not any one grant's strategic plan or just a deliverable. And I think that's really important for folks to be thinking about. PDG happened to be the mechanism that supported the update or supported the development of that plan. And now, there is a home for that plan with the State Advisory Council, which is Building Bright Futures. And I think also important to note is that Vermont state statute charges the State Advisory Council as the entity that monitors and maintains that strategic plan over time. So we have in place a 5-year cycle for monitoring that progress and updating the vision, the strategy, and the goals. And what we've seen as really effective is looking for additional opportunities to help support our ability or our capacity to maintain and monitor that strategic plan. So we also received in Vermont HRSA funding through the Early Childhood Comprehensive Systems Program to, again, think about how we are updating and aligning our strategic plan alongside early childhood, but also integrated with maternal and child health, very much so focused on equity. And I think what I've really loved to see is that across all of the federal grant initiatives, they have a very common thread, and folks are really focusing on similar topics that allow us to be successful and not duplicate efforts.
Great. Thank you, Morgan. Elaine, tell us what plans you have in Guam.
Pauline, did you want to start?
Oh, okay. Yes, I think I was going to jump in and answer and address the question. Guam is one of the new kids on the block, like Vermont. And so we just completed our initial year planning grant. And so we've come up with our needs assessment and I'm not sure if this is showing our strategic plan. So we shared this electronically, and thank you to the University of Guam Cedars, our partners. We've got the publications, and so we are just moving forward with it. The way we are planning on updating, it was Deborah, I think, that mentioned that we have to identify a central entity that will oversee this. And As you heard from Elaine, we have the Guam Early Learning Council created by executive order. It's governor appointed members. And so through that, and all of us early childhood programs are part of that, reporting to the Early Learning Council. So they will oversee the work that the PDG has begun. And we made it clear in the beginning that this strategic plan will be Guam's state plan for the next 3 years and beyond. And so because it is a living document, we have work groups within the Guam Early Learning Council to oversee all the different strands or activities. And so we'll have that continuous monitoring. We've embedded into it the CQI, continuous quality improvement, to monitor using the data and how we can improve the plan. So moving forward, because we just got our strategic plan completed. So I just wanted to stress that.
Great, thank you. Thank you, Pauline. Christy, what about North Carolina?
So we are in the process of updating our needs assessment right now as part of our PDG, but as I shared earlier, our strategic plan is comprehensive for North Carolina. And so North Carolina, as I think most of you probably have heard us say, we have a rich history of innovation. So we're going to use 2 of the strategies that we talked about today, the local strategic planning, as well as all of the different levels of work in family engagement and partnerships, to really build upon those existing efforts that we're going to continue to promote diverse participation. We're going to look at cross-sector collaboration and partnerships with our families and our organizations that have a vested interest in the improvement of child and family outcomes. We're going to continue to set bold priorities and achievable goals for North Carolina's young children. And then we're going to continue to track that progress toward those goals that ensure transparency and accountability and good stewardship of our resources. So as many others have stated, PDG is just the mechanism for us to continue this work, but we plan to utilize these continuous feedback loops to help us sustain this and build this as part of our mixed delivery system.
Great, thank you, Christy. And Melissa, we saw in your picture that acknowledges the end of PDG funding when you were thinking about your strategic plan as that comprehensive plan. So what are the next steps in Kansas?
Well, I would remind that Kansas is one of the 3 states that got the late award for the renewal grants. So we are still we're in the final quarter of our 2nd year. So we still have a little bit more time. But as we are evaluating progress along the way and beginning to set priorities for year 3, one of the things that we've already started are the sustainability talks that need to happen so that we are prepared next year when PDG funding is closed out. There are a number of projects that we want to keep up and running. So we're already thinking across our agencies and using the strategic plan as that guidepost. So we will employ, I think, the same strategy of ongoing feedback from stakeholders in the field, the general public, and making sure that we have our priorities in order and assessing what logical next steps need to be put into the plan as we achieve some of the more the shorter term time horizon goals that were embedded in the plan, and how we continue to refine the more general hopes that we increase alignment and make it easier to navigate and increase access and all of those things. So we have done a needs assessment annually. We're in process right now. That will help create the foundation for where we go next. But our strategic plan is intended to be a living document that continues to guide the work across our multiple state agencies.
Fantastic. Thank you so much. I put a comment in the chat. Does anybody have any last minute end of the webinar questions that they'd like to pose to any of us, including our state representatives? All right. I know I promised you we were going to share a lot of information and pack a lot of things into this. Quickly, in summary, remember that your strategic plan is a resource to build your comprehensive ECCE system. So it's not a standalone. It's an important backbone and framework for building that comprehensive system. You can use it to communicate. We saw some great examples of that. I want to remind you to review the brief that Kathy developed. It's got some great tips in there, some very good practical information on that. The strategic plan can and should be updated periodically. So don't feel confined into you do one update. That's okay. And it's great to have a big initiative, but also think about if there's components that don't feel just right, go in and revise that. So keep that as that living document. Strategic plan is your anchor, informed by your needs assessment and your program performance evaluation plan. Again, as Mandy talked about, they all are all interconnected. Connect with your FPO and TA specialist if you need any follow-up or need some additional support, and watch for the evaluation survey in your email. We very, very much value your feedback. I want to thank everybody for joining us today. I've appreciated all of our speakers. Thank you so much for your time, your commitment, sharing your talent, and your great ideas. And with that, I'll give you 1 minute back into your day. Thanks so much, everybody, for being here. Bye.